So, with the progression of the game of anatomy, we now are required to delve into another map. We had been delving into the map of the head and neck and the cranial bones, and obviously, we will be exploring that part also. But what I would also like is the simultaneous exploration of the upper limb as well. Now, the reason for this is that, see, the cranial bones, they are kind of getting a little, I would say, grindier, a little bit complicated. So, taking a little break from them would not hurt. Obviously, we will be continuing with the cranial bones, with the head and neck part, but if we can simultaneously focus, not too much, obviously, but a little bit of our focus, if that is shifted on to the upper limb, which is comparatively a lot easier than the head and neck part, which we were exploring before, then I feel like we might get a moral boost, and also it would be easier for us to win the game of anatomy. So, with that being said, we are today at the new location, a new map of the kingdom called upper limb. And the very first bone that we explore is the easiest bone, perhaps, of the entire, uh, skeleton or osteology section, and that is the bone of the pectoral girdle, clavicle. Now, obviously, we are to locate the clavicle, and obviously, we see it right on the screen here. So, this here is the clavicle. Okay, now as we can all appreciate, this is the anterior view of the clavicle, and it is a flat bone which is articulated on one side to the scapula over here and to the other side to the sternum over here. Okay, so now let's delve on to the clavicle, its gross anatomical features, its attachments, the different structures related to it, and also some of the peculiarities of the bone clavicle. Okay, so let's get on with it then. The very first thing that we need to appreciate about the clavicle is how it looks. See, this is the anterior view, and in the anterior view, it looks just like a flat, long bone which is lying horizontally with respect to the body, right? But the anterior view is not going to cut it. We need some other views. For that, what we need is the superior view. So this over here is the superior view of the clavicle. Okay? Now, listen very carefully. As you can already appreciate from the superior view of the clavicle, that the clavicle is a bone which is doubly bent. That is, there are two bends on the surface of the clavicle or on the shaft of the clavicle. See, the first bend is over here. This is one bend, and the next bend is over here. So, what we can actually say, or rather comment, is that the clavicle is a F-shaped bone. Okay, an F-shaped bone. Now, as we already know, the clavicle, it has these two parts. Okay, what are the two parts? See, the first part is the ends of the clavicle. So this over here, this is one end of the clavicle. This over here is the other end of the clavicle. Okay, whereas the part of the clavicle that is the majority of the clavicle lie between the ends is called the shaft of the clavicle. Okay, okay. Now listen very carefully. The clavicle is a bone which is occurring in pair in our body. There are two clavicles in our body, right? You'll appreciate that, obviously. So whenever there is a paired bone in our body, it becomes our duty to enumerate which sided bone it is. So the clavicle is also no exception to that. So we need to understand, or rather we need to demarcate, which sided clavicle is this? Is this the right clavicle or is this the left clavicle? For that, we need to understand how the medial end of the clavicle looks and how the lateral end of the clavicle looks. See, if this is the medial end of the clavicle, you can well appreciate that the medial end of the clavicle is oval, or rather cylindrical. See, the medial end is cylindrical, right? Whereas the lateral end over here is flattened. As you can well appreciate, it is flattened from above downwards. So the medial end of the clavicle is, rounded, cylindrical, whereas the lateral end is flattened. Okay, but that alone is not going to help us determine which side of the clavicle it is. So we need some other identification features to enumerate which sided clavicle it actually is. For that, we focus our attention onto the superior view. See, this over here is the superior view, right? I'm going to give you a fact and you need to stick to that fact, okay? As you can see, this over here, this side is the anterior view and this side is the posterior, okay? How I am telling this is because the clavicle is convex anteriorly at its medial side, whereas it is concave anteriorly at its lateral side. So what I am telling here? I am telling you that the clavicle is actually convex. You can already see here, right? It is convex on its medial side and it is concave on its lateral side. So that is another way of confirming which sided clavicle we are talking about. See, now I have reverted the situation. So you might think that this is the medial side and this is the lateral side. Why? Because the convexity is anterior here and the concavity is anterior over here, right? And I have just said that convexity anterior is medial side and concavity anterior is lateral side. However, that is the reason why I said the first point. If you see the end, you will see that this is flattened. So this is not the medial side, this is the lateral side. So I was holding the bone wrong, right? So this is the lateral side and this is the medial side. However, we need to demarcate which is the superior surface and which is the inferior surface, right? See, this is the inferior surface and suppose I am supposing that this is the superior surface. Are you getting me? I'm actually going by the process of permutation and combination as to what are the possible errors that one may encounter while holding the clavicle. Okay, so in that process I'm telling that suppose you confuse the superior surface with the inferior surface. So this is actually the inferior surface, I'm telling you that right now, but suppose you are thinking that this is the superior surface, then what can happen is that you consider that this is the medial side and this is the lateral side, but that is wrong because over here this is flattened, so this is the lateral side. So what are the identification points? The identifying points are, number one, you have to demarcate which is the medial end and which is the lateral end, and for that I have already said that you need to see the ends. This is the medial end which is rounded, cylindrical, whereas this over here is the lateral end. It is flattened. Okay. So by that way, we can say that this is the medial end, this is the lateral end. But that does not show which sided clavicle it is, right? If this is the medial end, then the clavicle might also have been placed like this, right? So it becomes a left clavicle then. But then I said to you that at the medial side, the convexity is anterior. So it cannot be that on the medial side the convexity is, or rather there is a concavity anteriorly. It cannot be. So this has got to be the medial side and this has got to be the convexity anteriorly. So that means it's a right clavicle. Okay. Whereas how to demarcate the superior surface from the inferior surface, that is also an important point. See, this point will be clearer when I will be talking about the gross anatomical features of the clavicle and the inferior surface. But you can already make out that the inferior surface has a lot of clear, rough demarcations. For example, there is a tubercle over here on the lateral side. There is also a rough impression on the medial side, all located on the inferior surface, not the superior surface. Hence, we can conclude that this is the inferior surface, this is the superior surface, this is the medial surface because this is rounded, this is the lateral surface because it is flattened. We can doubly confirm that this is the medial surface because the convexity of the clavicle is anterior here, and we can doubly confirm that this side is the lateral side of the clavicle because the concavity here is anterior. So the clavicle is convexo-concave. You may remember the clavicle as a convexo-concave structure. Okay, that is how you demarcate which side of the clavicle, or rather which sided clavicle you're talking about. Okay. Another very interesting point about the clavicle is, firstly, obviously this is the superior view, so that none of you get confused as to which view this is. See, this is the medial part, I said, but there is a better terminology to be more precise. That is, this is the medial 2/3 of the clavicle and this is the lateral 1/3 of the clavicle. An interesting thing about the clavicle is that at the junction point between the two parts of the clavicle, that is the medial 2/3 and the lateral 1/3, the junction between these two parts, the clavicle is the weakest at that point. The clavicle is the weakest at the point of junction between the medial 2/3 and the lateral 1/3. What is the reason for this? The reason for this is, firstly, see, the convexity is like this over here in the medial side. It's well convex and this side posterior is concave, right? So there is a definite curvature of the bone over here. But over here it changes and becomes concave. Whereas over here, this becomes the convex part. Okay, so what I'm implying is that the changes of the curvature of the bone happens at the junction between the medial 2/3 and the lateral 1/3. Hence, since there is a change of curvature of the bone over here, so it is a weak spot of the bone and has a potential chance of getting fractured. So the clavicle may get fractured at the point of junction between the medial 2/3 and the lateral 1/3. When can the clavicle get fractured? A very popular scenario for the clavicle getting fractured is when someone falls on outstretched hands. When somebody falls on an outstretched hand, the clavicle gets a high shock, right? And hence, At the point of change of curvature, it might break. Another reason which is cited is that this part of the clavicle, the junction between medial 2/3 and lateral 1/3, it is kind of devoid of any ligamentous support. We will see to this obviously when we will be talking about the attachments of the clavicle, but this part of the clavicle is generally speaking not having much ligamentous support or any muscular support, so as to speak. So it is prone to fracture. Okay, so that is an interesting point, and hence it is worth remembering. Okay. Now let's explore the clavicle and speak of the different parts of the clavicle. As I've already mentioned to you, the clavicle has these ends. This is the medial end, that side is the lateral end, and it has a shaft. Okay, the shaft also has, a medial side and lateral side. We'll see to that when we will be talking about the shaft. But for now, let's focus our attention to the medial end of the clavicle. Okay, so this is the medial end of the clavicle. See, as you have already seen, when the clavicle was articulated, the medial part of the clavicle, or the medial articular end of the clavicle, is articulated to the manubrium sterni. Okay, so the sternum has an upper border, an upper part called the manubrium sterni, and the clavicle articulates with the manubrium sterni at a notch, which is called the clavicular notch of the manubrium sterni. As you can see here, this is the manubrium sterni, this is the entire sternum, and this part is the manubrium sterni. So this articulation is taking place over here. This is the medial end of the clavicle. This notch over here on the manubrium sterni, this is called the clavicular notch. So obviously there are two notches on both sides of the manubrium sterni. This joint that is being formed over here, obviously the ligaments and other associated structures have not been shown in this model, but the joint that is formed over here, this is what we call the sternoclavicular joint. Okay, so this joint is called the sternoclavicular joint, and the sternoclavicular joint is very interesting. Why? Because there are three structures associated with the sternoclavicular joint. What do I mean? Listen. See, the two structures that are associated with the sternoclavicular joint we can already make out. That is the manubrium sterni of the sternum and the clavicle. However, there is another structure which is associated with the sternoclavicular joint. So what is that structure? That structure is the first costal cartilage. So the first costal cartilage is also associated with the sternoclavicular joint. Obviously it's not shown over here, but we can all appreciate the first rib over here. See, this is the first rib. This is where it ends, and the first costal cartilage is actually extending from over the first rib over here. See, we can all make this out, right? So the first costal cartilage is also associated with the sternoclavicular joint, right? So there are three structures associated with the sternoclavicular joint. The other interesting thing about the sternoclavicular joint is that obviously it's not visible over here, but there is an articular disc. Okay, there is an articular disc which actually separates the sternum into two compartments. Okay, there is an articular disc which is actually separating the joint cavity of the sternoclavicular joint into two compartments. What are the two compartments? One compartment is the meniscoclavicular, and the other compartment is the meniscosternal. So these two compartments are being formed where exactly? In the joint cavity. Which joint? Sternoclavicular joint. since there is a division of the joint cavity by an articular disc, this joint, that is the sternoclavicular joint, is called a complex joint. Okay, so it's called a complex joint. So a complex joint is a joint where the joint compartment or the joint cavity is divided into two compartments by the presence of an articular disc. Right? Done. Having known of the sternoclavicular ligament, we are now in a position to know as to what are the structures which get attached to the medial end of the clavicle. Okay, so what are the structures? See, I talked about the sternoclavicular joint first because the structures which are associated or rather attached to the medial end of the clavicle, they are all almost associated with the sternoclavicular joint. Okay, so the first thing that I'm going to talk about the attachment of the medial end is the joint capsule of the sternoclavicular joint. Okay, so since it is a joint, so there is a joint capsule obviously associated with it. So the joint capsule of the sternoclavicular joint is attached all around the medial end of the clavicle. Okay, so all around, right? Now there are some specific things also which are attached to the medial end. What are they? See, on the upper part of the medial end, there is the attachment of another ligament. What ligament is that? That ligament is called the interclavicular ligament. Okay, so both the clavicles on either side, they are connected to each other by a ligament which is known as the interclavicular ligament. The interclavicular ligament is getting attached on the upper side of the medial end of the clavicle. The thing about interclavicular ligament is that it actually holds the two clavicles at their positions so that the clavicles do not get displaced. So it is an important ligament. Okay. The next attachment on the medial side of the clavicle is the attachment of the articular disc, which I talked about when I was talking about the sternoclavicular joint. The articular disc, which divides the joint cavity into two halves, that disc is attached to the posterior-superior side of the medial end of the clavicle. So somewhere over here there will be attachment of the interclavicular ligament, and behind that, posterior-superiorly, there will be attachment of the articular disc of the sternoclavicular joint. Okay, interesting. Okay, having talked of the medial end, let's talk about the shaft. Okay, see, I had said that the shaft has this medial 2/3 and the lateral 1/3. Okay, now the medial 2/3, the anatomical characteristics of this side is a little different from the anatomical features of the lateral 1/3. What does that mean? See, I have already said that the medial side is rounded, cylindrical. So the medial 2/3, this is the posterior view. The medial 2/3 of the clavicle will have a superior surface. See this over here, a superior surface, a posterior surface, an inferior surface, and an anterior surface. Okay, so anterior, posterior behind, superior and inferior. These are the four surfaces of the cylindrical rounded medial side, or rather medial 2/3 of the shaft of the clavicle. Okay, now Let's talk about the different attachments and the different features also. The first thing is that, see, this is the anterior surface of the medial side, right? Anterior surface of the medial side of the clavicle, the anterior surface, this is giving attachment to an important muscle. Okay, so this side, this part, this is getting attachment from the muscle pectoralis major. Okay, the pectoralis major muscle, or rather, more precisely, the clavicular head of the pectoralis major. Okay, we will talk about the muscles in detail later when we will be dealing with the different aspects of upper limb, but for now we are focused on the clavicle itself. Okay, so what did I say? I said that the anterior surface of the clavicle, at its medial half, it is actually attached to the clavicular head of the pectoralis major. What about the superior surface? Superior surface, also in its medial half, it is actually again attached to another important muscle, that is sternocleidomastoid. Okay, the clavicular head of the sternocleidomastoid gets attached to the medial half of the superior surface of the clavicle. Now, sternocleidomastoid, from the name itself, we can make out that the sternocleidomastoid has three components: sterno meaning sternum, cleido meaning clavicle, and mastoid meaning the mastoid process of the temporal bone. Okay, so it's an important attachment then again. So we talked about anterior pectoralis major, superior sternocleidomastoid. What about inferior? See, can you see that there is a rough patch over here on the inferior surface? This was what I was talking about when I was talking about the identification features. See, this rough patch on the medial side of the clavicle, this is getting attachment from an important ligament. What ligament? The costoclavicular ligament. Costoclavicular ligament, that is actually attached to the inferior rough patch of the medial side of the clavicle. So costo means rib, clavicle means clavicle, obviously. So costoclavicular ligament means a ligament which is connecting the rib to the clavicle. Which rib are we talking about? The first rib. Why the first rib? Because the first rib is in relation to the clavicle, not the other ribs. Okay, so the costoclavicular ligament is attached inferiorly to the rough patch on the medial side. Obviously, all the attachments that we are talking about, all the aspects that we are talking about, all the gross anatomical features that we are talking about, they are all on the medial 2/3 of the clavicle. The lateral side, we are not yet talking about that. Okay, okay. Now, since we are talking about the inferior side, let's move a little bit laterally so that we don't yet go to the domain of the lateral 1/3, but still remain in the medial 2/3 itself. Okay, so a little lateral to this rough patch on the inferior surface, we see this, obviously you can make this out, groove over here. Can you see this? This longitudinal groove extending along the middle third of the clavicle. See, this is the middle side, the middle part of the clavicle, right? And obviously this is the inferior aspect. So this groove, which is present at the middle third of the clavicle on its inferior side, this is what we call to be the subclavian groove. Okay, the subclavian groove. Now, as the name is pretty self-explanatory, we can already make out that the subclavian groove is providing attachment to the muscle subclavius. Okay, subclavius. However, there is one more little information that I need to give you. The subclavian groove is obviously giving attachment to the subclavius, there is no doubt in that, but the lips of the subclavian groove. What do I mean by lips? See, the groove is a depressed area. So around the groove, there are these two lip-like structures which are marking the beginning of the subclavian groove, right? You may say that they are the boundaries of the subclavian groove also. Okay, there is another synonym that you might chalk out. Anyways, so the lips of the subclavian groove, they are providing attachment to what we call to be the clavipectoral fascia. The clavipectoral fascia. So we can say that the subclavius is getting attached to the groove itself, and the margins of the groove are getting attached to the clavipectoral fascia or the clavipectoral fascia. I don't really know what the pronunciation or the correct pronunciation is. I've seen incidents of both pronunciations, so I'm going to stay safe here. Anyways, so since the boundaries are providing attachment to the clavipectoral fascia or fascia, and the groove itself is providing attachment to the subclavius muscle, so we can say that the clavipectoral fascia or fascia is actually enclosing the subclavius muscle. Okay, so the clavipectoral fascia, it actually encloses the subclavius muscle. Okay, so what did we learn till now about the inferior side? We learned about this rough patch over here, the rough side, this rough area which is getting attached to the costoclavicular ligament. Okay, then we learned about the subclavian groove in the middle third of the clavicle with its lips, which is getting attached to the subclavius muscle and the clavipectoral fascia. Okay, now we are in a position to know about the posterior surface of the middle third of the medial side of the clavicle. So this over here is the posterior side of the medial aspect of the clavicle. This side is the medial side and this side is the lateral side. We're not yet talking about the lateral side. So interesting thing about the posterior surface is that it is actually related to a muscle again, that is called the sternohyoid muscle. So the posterior surface at its medial part is actually providing attachment to the sternohyoid muscle, which is actually a member of the infrahyoid muscle group. Anyways, so that is one of the muscle relations of the posterior aspect of the medial side of the clavicle. The posterior, this is the posterior side. The posterior surface of the medial side of the clavicle, it is related to very important blood vessels. Firstly, it is related to the termination of the subclavian vein. Okay, the subclavian vein. Also, it is related to the termination of the internal jugular vein. So there are two veins which are terminating at the level of the posterior surface of the medial half of the clavicle. What are those two veins? The subclavian vein and the internal jugular vein. Now, if we have a knowledge about the thorax anatomy, we should be able to immediately chalk out the correlation between these two veins. What is the correlation between these two veins? Are these two veins random? Subclavian vein and internal jugular vein just two random veins which are associated or rather related to the posterior aspect of the medial half of the clavicle? Is that the case? No. As it turns out, these two veins, that is the internal jugular vein and the subclavian vein, they are actually tributaries of the brachiocephalic vein. So these two veins are kind of joining to form the brachiocephalic vein. And the brachiocephalic veins of both the sides, that is the right and the left sides, together they join to form the superior vena cava. Anyways, I was talking about the brachiocephalic vein. So as I have said that the posterior aspect over here, the posterior aspect is related to the termination of the internal jugular vein and the subclavian vein. So it is also related to the commencement of the brachiocephalic vein. Does that make sense? It obviously makes sense because the two veins which are terminating, they are actually terminating how? They are terminating by draining into the brachiocephalic vein. So the commencement of the brachiocephalic vein is also from the point where its constituent veins are terminating. That is the posterior surface of the medial aspect of the clavicle. On both sides, obviously. Right? We are talking about the right clavicle. This is reflected onto the left clavicle as well. Done. This is about the vein relation. However, an artery is also related to the posterior aspect. That artery is subclavian artery. So we talked about the subclavian vein, the internal jugular vein, their termination, and obviously the commencement of the brachiocephalic vein. And now we are also telling that there is the subclavian artery also, which is related to the posterior surface. Done. Also, the trunks of the brachial plexus, they are also related to this aspect over here. Okay. Obviously, the brachial plexus is of prime importance in the upper limb, and we will be studying that. Okay. So we talked about the anterior surface over here, the superior surface over here, the posterior surface, and the inferior surface, all in correlation to the medial 2/3 of the clavicle. And we also talked about the medial end of the clavicle. So we finished kind of the medial 2/3 of the clavicle. Now we are only left with the lateral 1/3 of the clavicle. Okay. So the lateral 1/3, as I've already said, it is going to have different anatomical features than the medial part. Okay. So just like the medial 2/3 was rounded, cylindrical, the lateral side is flattened. I've said this a lot of times before. Okay. But since it is flattened, this time it is going to have some borders or boundaries, which the medial side lacked because it was rounded. Okay. So what are the borders and surfaces of the lateral surface or the lateral 1/3 of the clavicle? See, this over here, this is the anterior border. Okay, this is the anterior border. This obviously is the posterior border. This over here is the inferior surface. Okay, and this over here is the superior surface. Done. So it has an anterior border, a posterior border, a superior surface, and an inferior surface. Okay. Okay. Now let's talk about the anterior border. See, anterior border again, it is related to a muscle attachment. What muscle it is? It actually provides origin to the anterior fibers of deltoid. Deltoid is a very important muscle of the shoulder region, and the anterior margin of the lateral 1/3 of the clavicle is actually providing origin to the anterior fibers of the deltoid muscle. Actually, if we look at the entire picture, we will see that although we are only limited to the clavicle discussion over here, But extensively speaking, since the clavicle over on its lateral side will be articulated to the scapula via the acromial process, we will see that the origin of the deltoid is also extensive. It is not only limited to the lateral one-third or the anterior margin of the lateral one-third of the clavicle only. It is also extending along the acromial process and then the spinous process. Let me show you. So over here, this is the superior view. All right. So over here, this is the superior view. As you can all make out, this is the lateral side of the clavicle. And this over here, this side will be the anterior margin of the lateral side from where the anterior fibers of deltoid are getting attached, or rather origin. So you can already see that the acromial process over here, this is the acromial process, which is getting articulated with the lateral articular end of the clavicle. So what happens is that in case of origin of deltoid, the deltoid is getting its origin from the lateral half of the clavicle. Then it is extending to the acromial process over here like this. Okay. The acromial process is lateral margin, and then it will extend to the lower lip of crest of the spine. These are all related to scapula's gross anatomical landmarks. So we will talk about that later. But what I'm trying to prove here is that the origin of deltoid is extensive. And this extensive origin has a lot to do with how the bones are articulated. See, this is forming one continuous line. The lateral part, the anterior margin of the lateral half, the acromial process is lateral margin, then the inferior lip of the crest of spine of scapula. These are all forming one continuous line, and they are providing origin to the fibers of deltoid. So this part provides attachment to the anterior fibers, the acromial process part gives origin to the medial fibers, and the lower lip of the crest of spine of scapula gives origin to the posterior fibers of deltoid. Now, since we already have this articulated bone set, let's get on with another very similar attachment of the lateral side of the clavicle, which is again very extensive and extends to the scapula as well. And it is actually kind of parallel to the deltoid. Okay. The muscle which I'm talking about in this case is trapezius. So listen to me very carefully. Just like I said that deltoid origin, anterior fibers obviously, started from the anterior margin of the lateral one-third of the clavicle. Just like that, the posterior margin on its lateral half or lateral one-third, that is actually getting insertion of the trapezius muscle. Okay, so insertion of the trapezius muscle is actually happening along the posterior boundary. So just like deltoid was extensive along the acromial process and then the lower lip of crest of spine, just like that, trapezius also has an extensive insertion from the posterior boundary over here to the medial border of the acromial process to the upper lip of the crest of spine of scapula. So they are like parallel to each other, and that is actually serving us good because we can now remember two muscles easily. So the outer one, anterior attachment is the deltoid, posterior attachment is the trapezius. Now we have talked about the anterior border and the posterior border of the lateral one-third. Let's talk about the surfaces then. See, this is the superior surface of the lateral one-third of the clavicle. The superior surface is mostly subcutaneous. Okay, so it is mostly subcutaneous, whereas this over here is the inferior surface. Now, the inferior surfaces a little interesting because the inferior surface of the lateral 1/3 of the clavicle has some very interesting landmarks. So listen to me very carefully. See, you can already make out that there is a bony tubercle over here. This bony tubercle on the inferior surface of the lateral 1/3 of the clavicle, this is called the conoid tubercle. The conoid tubercle. The conoid tubercle can also be used as an identifying point, or rather identifying feature, as to which sided clavicle we are talking about, because the conoid tubercle is located laterally and inferiorly. So we are getting two confirmations at once, right? That this is the inferior surface that we are talking about, and this is the lateral aspect that we are talking about, right? So this is a conoid tubercle. Whereas over here you can see there is a slight depression or a ridge. This ridge is what we call the trapezoid ridge. Okay, so just lateral to the conoid tubercle we have the ridge. All of these are features of the lateral 1/3 of the clavicle, but of the inferior surface. I'm repeating these again and again so that you at least appreciate the importance of these features. Okay. Now, conoid tubercle and trapezoid ridge, they are again connected. Not connected by some physical structure, they are connected theoretically. How? See, the conoid tubercle is providing attachment to what we call to be a cone-shaped ligament. A cone-shaped or a cone-like ligament. That is why it is called conoid tubercle. Whereas the trapezoid ridge is providing attachment to a ligament which is trapezoid-shaped. Trapezoid-shaped. So that is why their names are like that. Okay, are you getting me? The conoid tubercle is providing attachment to a ligament which is cone shaped, and the trapezoid ridge is providing attachment to a ligament which is trapezoid shaped, a trapezoid like ligament. So what is the name of that ligament? The name of that ligament is coracoclavicular ligament. See, the coracoclavicular ligament, coraco means the coracoid process of the scapula, and clavicle obviously denotes the clavicle. So the coracoclavicular ligament, which is actually joining the clavicle to the coracoid process of scapula, that is actually having two parts. What are the two parts? A cone-shaped part, a cone-like part, which is getting attached to the conoid tubercle, and a trapezoid-like part, which is getting attached to the trapezoid ridge. This over here is a coracoid process, right? We will see to it when we will be talking about the scapula. But what happens is that the coracoid process, as you can all see from the posterior aspect, it has a root, right? So at the root of the coracoid process, the cone-shaped part, the cone-like ligament gets attached, and at the superior aspect of the coracoid process over here, you can already see here, the trapezoid part gets attached. Okay, so that constitutes the coracoclavicular ligament. The coracoclavicular ligament is very important. Why it is very important is because the coracoclavicular ligament is actually transmitting weight from the upper limb to the trunk of the body. The coracoclavicular ligament is the junction, it is the bridge between the coracoid process and the lateral half of the clavicle, right? So when there is a weight transmission from the upper limb, that is transmitted along the scapula to the coracoid process, along the coracoclavicular ligament to the lateral half of the clavicle, then transmitted along the clavicle onto the axial skeleton. So this one single ligament is so important because it is actually acting as a bridge of weight transmission between the axial skeleton and the appendicular skeleton. So it is a very important ligament. Now, having talked of all the aspects of the lateral 1/3 of the clavicle, we can now at last talk about the lateral end of the clavicle. So as we can all see, it's oval shaped as opposed to the round shape of the medial end. It is oval shaped. Okay. Now, we already know that this is articulated with the acromial process of the scapula, forming the acromioclavicular joint. Okay. So all around this lateral end, we have the attachment of the joint capsule of the acromioclavicular joint. Just like in the medial end, we had the attachment of the joint capsule all around the medial end for the sternoclavicular joint. Now, see the area of the anterior region of the clavicle, the area of the anterior region of the clavicle between the medial attachment of the clavicular head of the pectoralis major over here, which I had said, right? And the lateral attachment of the anterior fibers of the deltoid. This region forms the area or rather boundary of the deltopectoral triangle. Through the deltopectoral triangle, there passes an important vein of the upper limb, which is called the cephalic vein. So the cephalic vein is actually passing through the deltopectoral triangle. Another important thing which I would like to draw your attention towards is that, see, this is the superior view, and let me rotate it for you so that we see the actual representation. So this is the medial side and this is the lateral side, right? So over here onto the medial side, on the superior surface, we had the attachment of the clavicular head of the sternocleidomastoid, right? Right. What about the lateral side's posterior border? The lateral side's posterior border provided insertion to the trapezius muscle, right? See, this part is related, the superior surfaces of the medial side is related to the sternocleidomastoid, and the posterior border of the lateral side is related to the trapezius muscle. Why I am actually picking up these two random muscle attachments is because they are not that random. They're not random because the portion of the shaft between these two muscle attachments, again, that will form what we call to be the boundary of the posterior triangle of neck. When we study about the neck anatomy, we will see to these triangles formed by the different muscles and how they're related. But there is an anatomical triangle on the neck region called the posterior triangle of neck, and the boundary of the posterior triangle of neck is formed by the area of the shaft of clavicle in between the attachment of the sternocleidomastoid's clavicular head on the medial side and the trapezius insertion onto the posterior border of the lateral side. In between these, the region is forming the boundary of the posterior triangle of the neck. So there are two instances of the clavicle acting as a boundary or border. Firstly for the deltopectoral triangle and secondly for the posterior triangle of neck. Okay. The last thing which I would talk about was, or rather is, the peculiarities related to the clavicle. See, the clavicle, although it's a very easy bone, but it's a very peculiar bone. Why it is peculiar is because of a number of reasons. A number of reasons are there why the clavicle is peculiar. Firstly, which you can already make out, is that the clavicle is a horizontally placed bone. There is no other bone in the human body which is horizontally placed like this. There is no other long bone in the, obviously, human body which is horizontally placed like the clavicle over here. The second very important peculiarity of the clavicle is that it is the only bone to have two primary centers of ossification. Now, this is related to general anatomy, but we have a concept about the fact that when a bone actually develops, it develops or rather starts ossifying from a part of the bone which is called the primary center of ossification. Mostly that happens before birth. Okay, then the what we call to be the development, it is actually spreading through the secondary centers after birth, mostly after birth. Obviously there are peculiarities. So almost all bones, they have one primary center of development, but clavicle has two primary centers of ossification. Okay, so that is an important peculiarity also, right? Also, a very important point about the clavicle as a whole or general bone is that it is the first bone to start ossifying. In the entire body is the first bone to start ossifying. So that's an also important feature as well, right? Okay. And it is also a bone with no medullary cavity. These are all related to general anatomy of the bone, but we do know that long bones do have medullary cavity, right? But the clavicle does not have a medullary cavity. Okay, so it has no medullary cavity. And the last peculiarity of the clavicle is that it is sometimes pierced by a nerve. It is sometimes pierced by the middle supraclavicular nerve. So it is sometimes pierced by the middle supraclavicular nerve, and hence this also acts as a peculiarity for the clavicle. Now, as far as the applied importance of the clavicle goes, there's nothing much to talk about. I've already talked about the applied importance of the clavicle when I said that the junction between the medial 2/3 and the lateral 1/3 over here somewhere, that is very prone to fracture when somebody falls on outstretched hands. Okay, there is another abnormality which is actually associated with the clavicle, and that may arise when there is a congenital absence of the clavicle. So by birth the clavicle did not appear, or there was an imperfect development of the clavicle. So the clavicle was not developed correctly. That clinical condition is known as cleidocranial dysostosis. Okay, cleidocranial dysostosis. There is a congenital absence of the clavicle or imperfect development of the clavicle. And in such characteristic patients, you can obviously search the internet for images like that, or you can also refer to your textbook. It's given there, images about the cleidocranial dysostosis. The shoulders of the affected individual can be approximated. So the two shoulders on either side, they can be met together, they can be joined. That is the kind of flexibility which they have, but that's not in a positive sense, which I say. That is obviously a, or rather an abnormality. So cleidocranial dysostosis is another condition which is associated with the abnormal clavicle. So that, I feel like, wraps up the clavicle, which was the first bone in the upper limb, and also paves our way into the domain or kingdom of upper limb as we further go on and delve into the other missions which we will be having onto the future. Thank you. Signing out, your Medman.